Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us on the program today. Our guest in studio is returning to speak with us, Dr. Michael Feld, child, adolescent, and general psychiatrist with a private practice focusing on psychopharmacology, psychotherapy, and parent training. He's located in Northbrook, Illinois, and has a subspecialty in treating ADHD of all ages. And he's here with us to discuss some brand new proprietary technology that allows some greater ease and flexibility in treating ADHD. Hello and welcome to the program, Dr. Feld.
Thank you.
Thank you for returning. We're talking about a new method of treating ADHD. You're here on behalf of Neos Therapeutics today. Is that correct, Doctor?
Yes, it is.
Talk a little bit about Neos Therapeutics. How long have they been in existence, and exactly what are they involved in?
Well, I don't know exactly how long Neos has been in existence, but Neos is a pharmaceutical company that has developed the use of helping delivery systems of medication, and they've developed the ability to create an extended release oral dissolving tablet. So what they have done is created an amphetamine-based extended release oral dissolving tablet called Adzenys XR-ODT, and it's indicated for the treatment of ADHD in patients 6 and above.
Now you say it dissolves orally?
Yeah. So this it's an ODT. It's an oral dissolving tablet. When a child takes this medicine or an adult takes this medicine, all you have to do is place it in your mouth, and the medicine dissolves in the mouth. You do not need water to help swallow it. It's oral dissolving, so it will dissolve once placed in the mouth.
Now, is it more effective being dissolved in the mouth rather than being digested and then absorbed? What is the greater ease and flexibility with this particular drug? I mean, other than obviously not having a child have to, learn how to swallow a pill.
No, I think that's a great question. To say that it's more effective, that we know that Adzenys XR-ODT has been studied and approved by the FDA for the treatment of ADHD for kids 6 and above, or patients 6 and above. We know that the efficacy is hopefully well established. The key to the medicine is finding the right patient that would do well with this medication. And what you mentioned before is there is flexibility involved in this delivery system that might make it better for certain patients or more available for certain patients. There are children, adolescents, and adults who've really never swallowed a pill or a capsule. There are patients that do not want to swallow a pill or a capsule. There are also patients that are just looking for another form of treatment to see if they have greater efficacy or less adverse events. So they might be a good candidate. And there's some flexibility involved in this delivery system because the way it's an oral disintegrating tablet, the ODT. That allows for flexibility because the tablet is packaged in a way that it comes in a package of 6 pills in blister packs, but the ODTs can be ripped apart into one blister pack at a time. So we know that a lot of ADHD patients often forget to take their medicine, and by having this flexibility of you can carry this medicine with you easier than other medicines, and then if you do forget it, you have the ability then to remember to take it, and you can even take it in a place that you don't need water.
What type of reception have you seen from physicians? Sometimes there's a resistance to change. What are you seeing with this new ODT?
Well, in my clinical practice, I'm obviously seeing that I'm enjoying using it because I'm seeing patients that are responding well to it, and it's a good alternative for them. I'm seeing good efficacy, good onset of action, good length of action, and reasonable, tolerable adverse events or side effects. I think there are physicians that are more open, like you said, that are more flexible, and the physicians that I've talked to that have used it are happy, that we have another, a new extended release oral disintegrating tablet and another option to treat ADHD. And I think that many of them are obviously finding that people are responding well to this.
What type of person is a perfect candidate for this flexibility? Is the process to identify that candidate a lengthy one, and do you veer far from the traditional diagnosing method?
No, I don't. I mean, I diagnose in my practice. I would diagnose everyone the same way. I think any patient that has ADHD would be a potential candidate for Adzenys XR-ODT. It's not that there's one patient that's better than other. I think Adzenys XR-ODT could be a good use for almost any patient. There are specific patients that we talked about before that might be more potential first-line candidates, particularly ones that will not swallow, that aren't comfortable with the pill or a capsule, or that, like I said, that they know they forget their meds so much that this might offer greater ease and flexibility of transporting the medicine and having it with you. But my thought of it, the Adzenys XR-ODT, is we know it's FDA approved and on label for treatment of ADHD. So I look at it as any potential ADHD patient that we're looking to respond to medication. I would think Adzenys XR-ODT is a medication to consider.
Does it allow a person to adjust the dosage on their own? Sometimes you have a prescription, you get a pill splitter, your doctor says, oh, just take half or take 1 and 1/2. Does it allow flexibility in that area as well?
Well, the flexibility in allowing it is that there are multiple dose sizes, multiple ODT sizes. Okay. We want the parents and patients to work closely with their doctors to understand how to use Adzenys XR-ODT and to understand, obviously, the risks and benefits and to understand how to dose it properly. I do want to say that, all ADHD stimulants we know are federally controlled substances, and parents need to work closely with physicians to understand the risk of abuse or dependence and the other risk of adverse events and important safety information. So it's important for parents, obviously, to work closely with doctors to understand all this about Adzenys XR-ODT.
Now, being brand new, as we wrap up, talk about the cost. Are we seeing cost comparable to traditional treatment, or are we waiting for the cost to go down as this becomes more mainstream?
Well, my understanding is that the cost is fairly equivalent to other long-acting extended-release stimulant preparations. But what we need to know is that working closely with Neos has developed some copay cards and some other use of cards that patients are able to get their first 30 ODTs with no charge, and then there is a copay card that offers a reduction in copay, so that hopefully this will be more affordable for patients depending on their insurance coverage. But my understanding is that the cost of Adzenys XR-ODT is similar to other extended release psychostimulants.
And where can our listeners get more information about Neos Therapeutics and possibly take advantage of some of these incentives?
Well, first off, there is a website called AdzenysXR-ODT.com, and I would recommend that anyone visit it and look through it. The other point is that hopefully clinicians and doctors and nurse practitioners and anyone prescribing these medications also have some of the tools in these copay cards available to their patients when they prescribe it. But no matter what, patients certainly should visit AdzenysXR-ODT.com.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Been talking with Dr. Michael Feld, child and adolescent psychiatrist, discussing Adzenys XR-ODT and its proprietary technology that allows greater ease and flexibility in treating ADHD. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.